Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be discussing Charcot foot or Charcot joint. You may heard of it as. But first, if you could hit that subscribe button, it would be greatly appreciated as it does help my channel reach more people. So let's get started, guys. So what is Charcot foot or Charcot joint? So it is a rare but serious complication that affects people with peripheral neuropathy, especially those with diabetes mellitus. Okay, so Charcot affects the bones, joints, and soft tissue of either the foot or the ankle. The bones become weak and can break, and the joints in the foot or the ankle can dislocate. If not caught in the early stages, the joints in the foot can collapse and eventually become deformed. So you can see in the pictures that I put here, this is a normal foot right here, and over here you can see that it's down. So you would get this pressure right here, so the bone rubbing against the skin here, that could cause a pressure injury. Okay, so these pressure injuries, it can happen down here in the foot, or they can also happen up here in the ankle joint. Okay, anytime we have an open wound, this can lead to infection and even amputation, because once again, this often happens in patients who have diabetes, and once they start getting infections, they're super hard to heal. Okay, so a lot of times this does lead to amputations. So who gets Charcot foot? So once again, I said this is very popular in patients who have, well, it's a rare condition, but more popular in patients who have diabetes. Okay, so Charcot foot develops in people who have peripheral neuropathy. This is a condition which the nerves in the lower legs have been damaged. The damage causes a loss of sensation in the feet. Okay, so they can't really feel their feet. So what are the signs of Charcot foot? So that in the early stages, the foot is red, it feels warm to touch, and there is significant swelling in the extremity. So what causes Charcot foot? So researchers have not found one single cause of Charcot foot, but there are certain known events that create the right conditions for it to develop. So one known event is unrecognized sprain or injury. Because the patient has peripheral neuropathy, they can't feel pain or the sensation, and the injury can go unnoticed. So if a broken bone is not treated correctly, the deformity can worsen. Okay, this leads to foot sores and infection. Charcot foot has also been seen as a complication following organ transplant in patient with diabetes. Okay, this is due to the use of drugs that prevent organ rejection. Okay, when the midfoot is involved in Charcot foot, this creates a rounded bottom of the foot, as I showed you in the last slide. And it's called a rocker bottom foot deformity. Depending on the location of the bone break, the toes can start to curve under, like claws, or the ankle can become deformed or unstable. So how is Charcot foot diagnosed? Okay, in the early stages, it is difficult to diagnose. X-rays are often normal. If X-rays and laboratory tests are normal, Charcot foot is diagnosed by knowing the signs of the condition. So Charcot foot is suspected in people who have diabetes and peripheral neuropathy, and the following signs. So a red, hot, swollen foot without an ulcer, and an increase in skin temperature. Okay, so they'll check the temperature of the foot that's affected, and they'll compare it to the other foot, the opposite foot, because the temperatures should be kind of equal when you're comparing parallel sides. How is Charcot foot treated? So early diagnosis and treatment can prevent more damage and avoid deformity and other complications. So treatment has three main goals. So we want to take the weight off the foot, treat the bone disease, usually with a cast, and prevent new foot fractures. Okay, so first I'll go over non-surgical treatment. So first and most important treatment is to rest or take the weight off of the affected foot. This is called offloading. So in the early stages, Charcot foot offloading helps prevent inflammation and stops the condition from getting worse and prevents deformity. Okay, now in the later stages, protected weight bearing, so a walking boot, can prevent complications such as more damage to existing deformity and avoid new deformities. Okay, so offloading may involve putting the foot into a cast, which protects it and keeps it from moving. The patient usually wears a series of these casts over 8 to 12 weeks. They will be removed and replaced as swelling goes down. Crutches, knee walker, wheelchairs are often used to avoid putting any weight on the affected foot. And after the casts are removed, the patient is given prescription footwear, okay? Prescription orthotic footwear properly fits the foot and relieves pressure points to prevent repeat injury and ulceration, okay? A commonly used device is a Charcot restraint orthotic walker, okay, or a crow. The doctor may also recommend changes in patient's activity to further avoid trauma to the feet. So sometimes surgical treatments are needed. So surgery is recommended for patients that have severe ankle and foot deformities and they're unstable and at high risk of developing foot ulcers. In addition, if the deformity makes braces or orthotics difficult to use, the surgery may be indicated, okay? So after surgery, the patient will have to avoid putting full weight on the Charcot foot for an extended period of time. Anyone who has Charcot foot must be dedicated to wearing protective footwear and taking extra care of their feet for the rest of their lives. Okay, so this is something that you need to care for the rest of your life. So educating the patients and the family members about preventative care and signs to watch out for is a really important part in preventing further problems. So complications of Charcot foot. So deformity in any part of the foot or ankle can cause skin ulcerations from the bone pressing against the shoes or the ground, okay? When you have any bony prominence pushing against the skin, it can cause an ulceration, okay? So when Charcot foot affects an ankle or the joint may become unstable and floppy because tissue has replaced the bone in the joint, okay? So this is called floppy foot and can also cause ulcerations. So ulcerations are often very difficult to heal in these patients because of either diabetes, poor circulation in the feet, being on their feet all day. They have neuropathy, so they can't feel when they're in pain. So they don't do any preventative measures. Say, I had pain in my foot. Okay, I know that I'm not going to be standing on it, but someone with neuropathy, they can't feel that, okay? An infected ulcer that does not heal can be limb threatening, okay, and this will result in amputation. So those are the complications that can happen with Charcot foot. So what is the prognosis or outlook for people with Charcot foot? So all people with diabetes who have been treated for Charcot foot should have regular visits with a foot and ankle specialist or someone who specializes and focus on foot problems in people with diabetes. Okay, these specialists will watch out for new changes related to the Charcot and other diabetes related foot complications. Okay, people who have Charcot foot from other causes also should have regular follow-ups by a doctor, okay? So I hope this video did give you any answers or questions that you had. It answered those for you about Charcot foot. But that's all I have for this video, guys. I hope to catch you in my next one. Bye for now.